Everyone, it's Dr. Nye, and we are beginning with part 1 of the digestive tract. So if we look over here at Charles, you can identify this glandular tissue, which is a salivary gland called the parotid gland. It is anterior to the ear, and you can see part of the masseter muscle, okay, on the jaw. And then I want to point out the duct, Stenson's duct, where the saliva is essentially conveyed into the vestibule of the oral cavity at the level of the second molar, okay? And so again, that would be in the vestibule of the maxillary region. Now, just to point out some other regions of the digestive tract, of course, the labia are the lips. The frena, or a frenulum, okay, would be the thin connective tissue, okay, that basically anchors the labia or lips, okay, to the gums. Now, we will step over here, and I'm just going to point out the teeth that you are responsible for identifying. So of course we have, if we just go through the various teeth relative to the numbering system, we would start at the upper right, okay? And that would be tooth 1, and we go all the way around to tooth number 16, okay? And that is in the maxilla, so your upper jaw. Then you drop down and you continue with the numbering. So this would be 17, and then we go all the way around to number 32. So again, we start on the right side and we end on the right side. We start with the upper jaw and we end with the lower jaw or mandible, okay? So that is the numbering system. 1 through 16, drop down, 17 through 32. And then the type of teeth that we're looking at, if you look straight on, we have 2 medial incisors or central incisors, okay? And there are lateral incisors beyond those. And the same thing follows for the mandible. So we have 2 central incisors, then lateral incisors. Then, moving backwards, okay, posterior, we have the canines. So you have 2 canines for shearing. So once again, these would be the canines on either side of these lateral incisors. And then we're going to move on to the 2 premolars. The first and second premolar, and then our molars, first, second, and third molar. And people, that is essentially the same for both the maxillary region and the mandibular region, or our upper jaw and lower jaw. So once again, we'd have 2 premolars and then 3 molars, 1, 2, and 3. So that will conclude part 1.